We are getting the latest on COVID-19, and joining me now is Dr. Neha Narula from Stanford Healthcare. Thanks for being here.
Pleasure to be here. Thank you.
There are now more Omicron subvariants that have been detected, BA4, BA5, as well as BA2.12.1. What do we know about those subvariants?
Yes, this virus has a way of keeping us on our toes. So these subvariants are descendants of the original Omicron variant that we saw late last year into early this year. It was the most transmissible at its time, but now these subvariants have been found to have more advantageous mutations that are raising red flags for the medical community. The BA4 and BA5 subvariants are resulting in a spike in cases in South Africa. They've been found to have some genomic changes that help this virus evade our immune systems. Whereas the latest member of the Omicron gang, the BA2.121 variant, has a mutation that loosens up the spike protein that helps it attach onto our cells better, facilitating infection. This is the variant that we're actually seeing here in the US in the Northeast region that is responsible for the uptick in cases that we're seeing. And it is the latest studies are showing that it's about 25% more contagious than the BA2 subvariant, which is the dominant strain nationally. These subvariants are reaching contagiousness levels that are almost at the measles level, which is very, very contagious, very transmissible. And to give you a comparison, the original virus that originated from Wuhan, one person that was infected could potentially infect 2.7 people at its highest. These subvariants are looking like if a person is infected with one of these three subvariants, they could potentially infect up to 12 people. So very contagious. Preprint studies from South Africa do show, again, the contagiousness, but good news is that it's not more virulent, meaning they're not causing worse infections with severe disease, particularly in people who are already vaccinated. So we don't need to panic just yet. Early findings are showing that vaccinated people are doing fine. There is some concern for people that have natural immunity. With prior variants and even the Omicron variant, actually, their immunity is looking like it wanes and it does not protect them against these subvariants. So as we see this play out, we've seen this again and again these past couple of years. We're learning in real time. It is important to continue to protect yourself, minimize complications, deaths, long COVID, continue masking, even though restrictions have been lifted, get your vaccine and booster if you haven't already, and continue to take some of these precautions we've been hammering in the last 2 years.
And we've seen several variants of concern come and go by now, Gamma, Iota, Mu. Is there anything we've learned from those variants that'll help us prepare for new variants in the future?
Yes. So, most of our news, we get flooded with news of Delta, Omicron, and now these subvariants because they have spread so rapidly around the globe. But like you said, variants like the Mu variant from Colombia, Gamma from Brazil, the Iota variants, they tended to fizzle out. They spread locally from their origins, but never really made it across the globe. And they are equally important to looking to look at potentially how this virus is going to continue to evolve and how these variants will affect us on not just a local but a global level. So specifically looking at Mu, its genome was studied very closely because at the time that it was found to have mutations that made it the most evasive, more than alpha, beta, and even gamma at that time. And so we were thinking, hey, this may be extremely devastating. But what happened was as Mu kind of hopped out of South America, Latin America into Europe and North America, that was already seeing the Delta variant dominate those regions. We saw that the Delta variant was not as evasive to our immune system, but was much more transmissible than the Mu. And so it kind of, in competition, it kind of kicked Mu out of the picture because of how contagious it was. So studying these lesser variants actually helps us just as much as looking at those that take the global scale. And then in addition to the mutations, we also can study the strategies that help contain these variants locally and prevented them from spreading to a global level as well. So thankfully, we have the technology to sequence these variants in real time. And honestly, that is the key to predict and prepare for what may be coming next.
And now that supplies of Paxlovid, the antiviral pill, are increasing, who should take it? Is it just for those at higher risk of more severe symptoms?
Yes, so indeed, the increasing Paxlovid supply is such great news, especially in light of these more contagious variants. This is, again, the oral drug that helps prevent infection from becoming severe and requiring hospitalization. The FDA has approved it for high-risk pediatric patients over the age of 12, as well as adults that have a high risk of developing severe COVID-19. So medical conditions that can increase your risk of developing severe symptoms would include anything like chronic kidney disease, liver disease, lung disease, diabetes, heart conditions, stroke, obesity, cancer, as well as other medical conditions that kind of dampen your immune response. So this medication has to be taken within the first 5 days of symptom onset. So it's important to talk to your medical provider as soon as you find out that you are testing positive for COVID. Your provider will likely talk to you about your symptoms, when your symptoms started, and also discuss the current medications and supplements you're on, because there are several drug interactions that can happen with this antiviral pill. I also do quickly want to add that this medication is getting a lot of buzz this week because patients are noticing some rebound symptoms. While this was not expected, it is still happening in a very small percentage of patients. And this does not mean, again, I want to emphasize this does not mean that this medication isn't working. This medication is very effective. This is likely happening due to the medication's short half-life. So as soon as you stop taking it, it kind of exits your body very quickly. And in some people, the virus is still inside, it's still replicating. And so it will not cause you to have severe symptoms or develop the severe disease after you finish its course, but you may still have some symptoms after you're done with it.
Okay, great. That's good to know. And finally, if you get the vaccine or a booster, are there any particular foods that can help prevent more serious side effects or anything we should avoid?
So it is being hypothesized that just like when we're ill or have chronic inflammatory conditions, diets like the anti-inflammatory diet can be helpful in preventing some of these side effects when people are vaccinated. Again, the research here isn't robust. Some studies are looking into this, but we can apply similar principles that we know strengthen our immune system so that it works in its optimal state. Unfortunately, in the pandemic, we have seen that diets haven't been the best. We're leading a more sedentary lifestyle. And so diets like the anti-inflammatory diet are super healthy, right? They include whole unprocessed foods. They limit refined foods. Lots of fruits and vegetables are included, nuts, seeds, fatty fish. Those are all fantastic ways to improve your nutrition and get vitamins and nutrients through foods that can help impact our immune system in a positive way. So a diet that is rich in these types of nutrients can help strengthen our immune system and potentially lower the chance of developing some of these side effects. Along with this, I always tell my patients, make sure you hydrate well before the vaccine and on the day of. Don't go on an empty stomach. Eat a healthy meal or snack before you're getting vaccinated to keep your blood sugars nice and level. And choose foods that are high in protein and fiber, both before and after getting a shot. Avoid alcohol the night before. That tends to dehydrate you. And then, of course, get a good night's rest. When we're stressed, tired, our bodies have a way of reacting and having side effects from vaccines. And so making sure that you're checking off all these healthy boxes can be a good way to essentially prevent some of these side effects.
Absolutely. Well, thank you so much for joining me today and for all that great information.
Thank you for having me.